The state announced a partnership with health plans and insurance plans to improve the COVID-19 vaccination equity and access. This partnership will expand existing work that's trying to expand access for vaccines for people who are most impacted by COVID-19. The state of Minnesota is partnering with Minnesota Health Insurance Plans to improve the COVID-19 vaccine equity and access. Starting next week, the Minnesota Department of Health, MDH, and the Minnesota Department of Human Services, DHS, will work with private health plans to continue to identify Minnesotans who have been most impacted by COVID-19 and who continue to face barriers to getting vaccinated, and will connect them with vaccination opportunities. Participating health insurance plans that will be starting this work next week include Blue Cross and Blue Shield of Minnesota, Health Partners, Hennepin Health, Itasca Medical Care, Medica, Preferred One, Prime West Health, South Country Health Alliance, and UCare. Dr. Nathaniel Chumilo, COVID-19 Vaccine Equity Director for MDH and Medicaid Medical Director for DHS, has commented that immunizing for impact requires us to measure our success not only by how fast we are able to get Minnesotans vaccinated, but also by how we are reaching communities that have the highest risk for COVID-19 and who have already been hardest hit by the pandemic. Our Minnesota health plans have found unique ways to support their members and communities' health, and this partnership will allow all of us to expand our resources, coordinate our efforts to get more Minnesotans connected to life-saving vaccines, and continue to build a more just and community-driven approach to health. The partnership program will work to reach out to Minnesotans who are enrolled in Minnesota health care programs, which are called MHCPs, such as Medical Assistance or MA, and Minnesota Care. These also are people who live in zip codes with high social vulnerability index scores, SVI, and have not yet been vaccinated for COVID-19. The insurance plans will work with the state to contact members and provide information on vaccination, assist with scheduling appointments, help plan for their vaccination, which could include arranging transportation or other services if needed. Blue Cross and Blue Shield of Minnesota recently conducted a 2-week pilot for the program using text message outreach. And this contributed to a dramatic increase in walk-in appointments, 6 times higher than normal within a week following this text campaign. Lucas Ness, President and CEO of the Minnesota Council of Health Plans, has commented, "This commitment to vaccinate the most at-risk populations will not only go a long way toward beating back COVID-19, but help us to close other health disparities that are very common in Minnesota. Minnesota's health plans are continually looking for strategies to best reach vulnerable communities, and we're looking forward to helping and work with the state on this critical initiative." Steve Gottwald, Executive Director of the Minnesota Association of County Health Plans, has said that it takes local partnering and responsiveness to effectively address healthcare inequities. Our community or county-based plans continue working to improve vaccination rates among communities most impacted by COVID-19, and those counties that still face barriers. This partnership with the Department of Health and Human Services helps us target those efforts and measure progress. An analysis done last year by the State Health Access Data Assistance Center from 2018 data showed that approximately 44% of African American, 39% of Native American, 31% of Hispanic, and 20% of Asian Minnesotans under the age of 65 rely on MHCPs for health care coverage. MHCP coverage for African American, Native American, and white Minnesotans is higher outside of our 7-county metro area. Additionally, more than 100,000 Minnesotans with disabilities and their families rely on MHCPs and face additional barriers to accessing routine care and services. Participating insurance health plans will have the support of state agencies to reach out to members of BIPOC communities, as well as those living in areas with higher SVI scores, which have been shown to be at increased risk for COVID-19 outbreaks. MDH uses SVI scores and other metrics to inform more equitable distribution of the COVID-19 vaccines and decrease the likelihood of future outbreaks among communities who have already been hit the hardest. The focused efforts by the participating insurance plans will help make sure that people living in these areas not only know how and where they can be vaccinated, but reduce any barriers preventing them from accessing a vaccine. Dr. Chumilo has mentioned that given the structural and societal barriers of MHCP enrollees face in accessing care before the pandemic, this partnership is now a recognition that we need to continue to go the extra mile and rebuild trust with the communities we serve and help mitigate further inequities in access.